I think with healthcare, the consumer is looking for trust, right? A decision to work with a certain healthcare provider, choose a certain course of treatment for a condition. There's much more trust that is needed in that decision before they make that choice, right? So if you contemplate buying a CPG category like food or clothing, it's many times more impulsive, more emotional. When we talk about healthcare, it's really about something that you're putting in your body, something that someone is giving you guidance for to solve a really difficult, challenging problem. That requires trust. It requires building trust with the consumer. That takes time, and it takes a really thoughtful approach to creative and how you tell that story and tell how your brand can deliver on this really difficult challenge for the consumer. So we seek to do that. We seek to really focus on putting those trusted messages in market and doing that with consistency over time.
Well, that theme of trust is kind of tied to the idea that healthcare marketing is generally considered traditional for the most part compared to maybe other areas. How do you balance growth ambitions with the constraints of healthcare marketing as this more traditional space?
Yeah, I think for us, we want to really focus on creative, how we can tell a creative story that's different from what one might see in a traditional healthcare ad. I think consumers have a model of healthcare advertising as boring, staid, formulaic, structured, and we try to flip that. We try to be really, in our creative, incredibly poignant. We want to tell real human stories. Every patient is a human. Every patient has real human motivations and reasons why they seek care, reasons why they're looking for help or looking to make a change in their health and their health journey. And so we really try to focus on those stories, tell those stories because they're the most relatable. And we find that connects so much more than the traditional kind of staid healthcare marketing that you see and historically have seen as a consumer.
Well, creator partnerships and influencer marketing are pretty much common in DTC. Again, I'm going to stick with that traditional theme that healthcare is known for. So how do creator partnerships, the working with influencers, fit into healthcare? And maybe what's different about building trust with those parts?
Yeah, I think for us, it's part of that broader story. When you think about healthcare and the health conditions that we treat, so at Row, we support weight management, sexual health, dermatology, fertility. In these areas, the number of people that could benefit from some type of treatment is in the tens of millions, at least in the United States. And so when you think about that, there's a breadth of folks that would benefit that runs the gamut of everyday people to celebrities to social media influencers to kind of anyone under the map. And so our thought is it's our way to tell really thoughtful brand stories across these personas, right? Across someone who is an influencer all the way up to someone like Serena Williams, who we partner with for our weight management vertical. And so the kind of human thread of the challenges they're trying to solve for, of trying to lose weight after having kids or overcoming an injury, seeking help for kind of a long-standing skincare issue. All these things are relatable and human at all kind of stratas of fame, impact, et cetera. And so we'd like to work with a breadth of folks, and so that's where influencers really come into play. They help us tell this kind of human level story at kind of all levels of the kind of attention strata.
Will, wanted to also get a sense of how you see things developing, particularly when it comes to the perspective of a healthcare DTC focus. What's the biggest shift you're seeing in terms of the ways consumers discover and engage with health solutions?
Yeah, I think one thing is health is always unique, where search is an incredibly important part of the journey. So consumers are always looking for information through search, right? They're asking Google, or now increasingly AI engines, tell me more about this symptom. How can I treat this condition? What's a nice solve for this problem that I'm facing? And so that kind of education piece is always important. I think more important than other categories. And so we want to focus on that, but we also realize a lot of that search behavior is shifting even to video and vertical video. And so you see where people consume content, they're consuming it more increasingly on their phone, in short snippets, in a vertical video. So I think we're thinking about both of those planes simultaneously. How do we make sure that we still provide really incredible trusted content when someone comes through a search channel, whether that be traditional search or increasingly now AI search, but also realize that people are seeking for information, products, services through vertical video on their phones, and we want to make sure we really have incredible content to map to that audience too.
Will, I also wanted to touch a bit on Row's own growth growth journey, growth story. How are you thinking about media investment? Is it about performance, brand building, or finding the right balance between the two? Do you see them as opposing forces or something that complements?
So we're in the camp where we don't internally view any difference between brand and performance marketing. We think that even performance channels can have brand elements. Really, I think we don't want to get in the trap of having two different methods of measurement, two different systems of assessing success. Ultimately, all the things that we do as a brand, as a marketing function, needs to contribute to the growth of the business. But building brand awareness happens, but it takes time. It takes time and repetition. And so in many cases, I think when people talk about what is brand marketing or how does something have a brand effect, it's really to say you might do something now in the near term that just takes a bit longer to accrue the benefits. And so we really try to think about that in that lens to say we might want to make an investment in something that changes the perception of our business or the broad awareness of it. That may not lead to someone purchasing in that moment, but that's still a valuable exercise. And so we try to, instead of putting them in different camps, look at it as one, understand how they work together, and really pursue the best blend of tactics in the long run to grow and build a business.